Hello dear audience, I am Professor Dr. M A Erfan, a colorectal surgeon. Today I am here to talk to you about a particular disease of the anal canal. As you know, I have been practicing colorectal surgery for a long time, and currently I have focused my attention on laser proctology, which is the treatment of various diseases of the anal canal using laser. I am now one of the surgeons in the world with the highest number of patients treated for anal canal diseases via laser. And my success rate is also one of the highest in the world. Treatment with laser is very patient-friendly, so we are now applying it. Our new chamber is a very modern, well-equipped and patient-friendly facility. You are welcome here. If you have any questions about any topic or want to know anything, please ask us and we will try to answer. Today we will discuss the non-surgical treatment of anal fissure. We have already discussed what an anal fissure is in my previous programs. Still, to put it briefly, an anal fissure is a tear in the anal canal. If a person has constipation or any abnormality in the anal canal and they strain during a bowel movement, the anal canal can tear. After this tear, there can be bleeding, pain, burning, swelling, and discharge. Can this anal fissure be treated without surgery? Yes, it can. Especially an acute anal fissure, the kind that happens suddenly, we usually treat it with medication. What is given here? Usually some soothing ointments are applied to the anal canal to prevent injury during bowel movements and to reduce pain and inflammation. Several types of ointments are usually prescribed. Secondly, medication is given to keep the stool soft so that it passes easily. Thirdly, sitting in warm water is often advised to reduce pain and provide relief. If there are other associated conditions like hemorrhoids or an infection, medicine for those will also be given. Usually with these medications, if the patient uses them regularly and avoids constipation, the acute anal fissure gets better. No surgery is needed here. But if it becomes a chronic anal fissure, meaning the person has had it for a long time and it tears repeatedly despite medication, then the effectiveness of medication decreases. However, it can still work with ointments and stool softening medicines, but it's important to ensure the patient's bowel movements are normal. If the patient often has constipation or if the anal fissure keeps recurring despite medication, then it's very important to get it corrected through surgery, because if not, other complications can arise later. So in the early stage, if the patient comes to us, we can cure this disease with medication without surgery. Therefore, the first condition for receiving this non-surgical treatment is patient awareness. If the patient comes to us early on, we can treat them effectively. Often patients don't seek proper medical advice and just take painkillers, which provides temporary relief, but the problem eventually becomes chronic. So an aware patient will get well sooner, need less intervention, and stay healthy. I hope you will all be aware and conscious. Thank you all.